Hello, wherever you are, and welcome to this important webinar on health and particularly on the vaccination of healthcare workers. Before I commence, I'd like to acknowledge that I'm on the land of the Ngunnawal people, and I pay my respects to Indigenous people in my land and across the world. And I do that because of their disadvantage. And so I also extend that respect to all disadvantaged people and hope that we can make a difference in terms of their health. Our focus today particularly is on low and middle income countries and health workers in those countries. And we have a terrific panel with us. We're going to start today by first of all acknowledging the support that we've had from the University of Geneva, from the Italian Public Health Association, and from Pfizer. This is really appreciated. Without that support, we would have trouble to be able to run these sorts of webinars. We have a number of speakers with us, and we're going to begin with a presentation from Dr. Marta Lamazzi. Dr. Lamazzi is the executive manager of the World Federation of Public Health Associations, and Marta has been heavily involved in developing the policy of the World Federation regarding the issue of low and middle income health workers in low and middle income countries. I should have introduced myself. I'm Michael Moore, and I'm the chair of the World Federation of Public Health Associations Global Task Force on immunisation. So I will introduce each of our speakers. They are in front of you in detail as they begin to speak. But from the World Health Organization, we have Stephanie Shendale from Mongolia. We have Nongjago Ayazana from Cameroon. We have Dominic Konji, and we have Anawulupo Makinda from Nigeria. So I'm looking forward to hearing from each of these people very briefly, and then they'll wrestle with the critical issues in their countries. So I'll hand over to you, Dr. Marta Lamazzi.
Thank you very much, Michael. It's my pleasure today to be here with you all and discuss the policy we have developed as the World Federation of Public Health Association to support the development and implementation of policies that will protect the healthcare workers through appropriate immunization. We have been through a process of discussion with our National Public Health Association from low and lower middle income countries through a survey focus group. And those discussions has led to a development of a policies that is focusing on specific aspects: improved funding and access, policy and advocacy, protecting high-risk health workers, engage the young generation of healthcare workers and community leaders, collect national data and partnership. I will now very briefly drive you to each of these points that has been organized into a policy and a call to action that will be presented to our General Assembly in May. And once approved, this policy will be available to all National Public Health Association and professionals to help them in their work with the governments to facilitate the development and implementation together with our key entities around the world of policy that will protect them and the community and the patient in their work. So the first topic was about ensure adequate funding and access. As you may know, in many of those countries, we have specific schedule and budget for kids, pregnant women, but very limited activities are done around adults and healthcare workers. So we need to have first a schedule and second, a funding and access for this specific category. And we start with funding and access here. So in most of cases, healthcare workers need to pay their vaccination. That could make it a great barrier for them. So we need to find alternative solution to make sure they can be protected through vaccination without paying for that. One idea is to work with other key partners, and we have some around the table here, NGOs, Gavi, WHO, COVAX, to find a way to provide free vaccination. We may consider having an insurance for healthcare workers that cover the vaccination cost. Concerning access, we need to work in a different way, maybe considering the production of vaccine locally, which will guarantee easier access and maybe lower cost. The second point is about data. Unfortunately, we have very limited data from low and lower middle income countries. And without data, it's not possible to develop strong policies and to implement them because we don't know where we are starting from. We have discussed during the focus group about DALYs, policy of disability adjusted life years, quality of adjusted life years, but any kind of data concerning healthcare workers, but also the community and the patient they're working with are key to prepare and implement a policy. Another very important point is about engaging people, engaging community leaders and engaging the young workers. Also, healthcare workers are influenced by belief and also may suffer of a more limited literacy about this specific area because they are training in their specific specialty. And not always we have training about vaccination during the medical school, the nurse's school, or other school. So we need to work on two specific aspects. One is building awareness, creating literacy. This from a very young age, from the health school, from the university. And second, we need to work with the traditional leaders, the cultural leaders, and this can change very much depending on the country we are referring to, and make sure that they support the message of vaccination, to make sure we all work together towards the same target. And during the focus group discussion, we have a very interesting focus on the International Federation of Medical Students. There could be a promoter of vaccination because they have a chapter in every country, and the young generation is more aware of the importance of vaccination and could be really the moving health workforce that will make a change in the country. So we need to make sure that we engage the young generation to make a change in every country. As Michael said at the beginning, we acknowledge the most vulnerable population in the world, and within the healthcare workers, we need to maintain a focus on the most vulnerable healthcare workers too, which refer to those that work in high-risk setting, could be critical care medicine, intensive care unit, emergency department, and many more. So we need to start with them to protect the most vulnerable, and then, of course, expand the target to the whole healthcare family. Policy and advocacy. We at the World Federation of Public Health Association devote a lot of efforts toward policy, and advocacy is one of our core values. And we know that it's not easy, but it's something that needs to be worked over years. And when we have a good policy that is implemented, then it makes the change. So as I said at the beginning, we need to have a policy that is specifically targeting healthcare workers, which means then having specific schedule, specific funds, and specific infrastructure, access, communication, everything that is around a program that is addressed to healthcare workers. Several ideas have been proposed, and one that is very interesting is to include health worker vaccination as part of the occupational safety plan, which is in line also with WHO recommendation for the specific target population. In many countries, we have occupational safety plans that, for example, target chemical hazard, but this is not enough. We need to protect healthcare workers with any means that is available to protect them and the community and patient they are working with. So this could be, of course, a very structured approach that will be more, let's say, easy to implement. Whatever direction is taken, we need to have a step-by-step approach from advocacy, to the implementation of the policy. So to make sure to protect the target population. And to achieve that, we need to work in partnership. We have already a series of important organizations that work towards supporting vaccination in different countries, which are cite few like WHO, Gavi, the World Bank, CDC, UNICEF. But we need to make sure that other actors are on board, like public health institutions and university, and of course the government that will finally decide about implementation and funds to dedicate to a specific schedule of vaccination for the healthcare workers. So develop and nurture partnership is of utmost importance for these specific projects. And we need also to make sure that the funders and the organization understand the need to do something specifically for this target population, for the well and health of the healthcare workers, but also for the general health and well-being of the communities and the patient. Thank you very much.
Thank you very much, Marta. And so with that background and outline, we'll now go to each of our guests and ask them to give us just a short presentation on one of those factors, and to begin the ball rolling with also a World Health Organization perspective is Stephanie Schendale, who is a technical officer in the Department of Immunization, Vaccines and Biologicals, and the Essential Program on Immunization, or EPI, at the World Health Organization. She has worked on immunization policies and strategies with WHO since 2014, where she's been working on strengthening immunization systems, life course vaccination, and integration of routine immunization services with other primary health interventions. Prior to joining the World Health Organization, she worked for Public Health Ontario in her home country of Canada. Stephanie.
Thank you so much, Michael. And can you guys see my screen okay? I just started projecting. Okay, great. So thank you, and thank you, Marta, for that good introduction, because you already flagged up a number of key issues that I'll touch upon as well. I just wanted to start, though, by sort of reminding all of us that when we're in the context of immunization and we're talking about health workers, they're a very unique and special target population for immunization programs because, of course, some of them themselves are actually vaccinators, and they're very trusted sources of health information, and therefore can be very, very effective and important vaccine advocates for their patients and communities. But then, of course, themselves are also beneficiaries of vaccination programs, which means we have to think about the important ways of reaching them, the same as we would when we consider reaching any of our other target communities for vaccination. So thinking about things like access, availability, affordability, convenience, a lot of the points that Marta raised. And then, of course, also creating that demand and understanding about the importance of vaccination amongst these individuals themselves, so that they, are aware of the importance of getting vaccinated and are seeking out those services. So they really serve a lot of different roles when we're talking about vaccination and health workers. And so I also just wanted to sort of couch this conversation within the existing global recommendations that exist for health worker vaccination. I know a lot of focus in recent years has been around COVID-19 and the importance of vaccinating health workers as one of the highest priority groups for that vaccination. And in some countries, that's actually the first and only vaccine that's been targeting health workers. So it's definitely a good entryway into this population in some places. However, WHO has a number of recommendations that already exist that highlight the importance of vaccinating health workers against a number of other important antigens, such as measles, hepatitis B, influenza, meningitis, and these are all summarized in one place to make it easier for people to access in what we call summary table 4. It's the third bullet point on this slide and the links at the bottom, and it pulls together the recommendations from the existing antigen-specific position papers that WHO publishes for vaccine recommendations, and highlights those that are of particular importance for health workers to protect them in their workplace. Vaccination is also a key recommendation for all health and safety, occupational health and safety programs, Marta already mentioned, and it's included as a right to safety in the workplace under the WHO Health Worker Safety Charter, which was publicly ratified a few years ago. Health worker vaccination is also a key strategy within a number of global health strategies for specific disease control initiatives, such as viral hepatitis, measles and rubella that I already mentioned. So there's definitely a lot of existing global recommendations out there that can be used as a backbone for support of these when advocating within your national contexts. And then the last thing I just wanted to share is that recently, the Immunization, Vaccines, and Biologicals Department, where I work within WHO, we published this implementation guide for vaccination of health workers. This just came out last year, and it's available in English, French, Spanish, and Portuguese. The Portuguese is not yet online, but it will be coming soon. And it is focused on vaccination in general, not specifically COVID-19. As I mentioned, there's a number of recommended vaccinations for health workers. And so we pulled together those existing recommendations in one place. And we outline, how a policy and framework for health worker vaccination can be developed, how health worker vaccination can be integrated into existing national occupational health and safety policies and programs, as well as the management of these practices within the health facilities, which are often the ones responsible for administering these programs. And we cover in this guide a number of different strategies that can be implemented. For example, pre-service screening, so bringing this into the actual training programs for medical professionals, where there's an opportunity to screen them for the existing vaccines that they've already received in childhood or adolescence, and then bring them up to date with anything that they're missing before they actually enter the workforce. There's strategies, of course, for vaccinating current health workers, and this is very important for the seasonal vaccinations such as influenza, and possibly in the future, things such as COVID, which may or may not become, a regular need for ongoing vaccination of health workers. And then, of course, there's also the reality that there could be outbreaks and emergencies, such as we saw with the pandemic, that require deployment of vaccines to the health workforce quickly and effectively. So all these different sort of potential strategies that should be considered when designing and implementing a health worker vaccination strategy are all in this guide. So the link to that is there, and I encourage everyone to go and take a look at it and let us know what you think. So that's all for me. Looking forward to the discussion later. Over.
Thanks very much, Stephanie. And it's a good time for me to point out that this webinar will be put on the website of the World Federation of Public Health Associations, so you'll be able to go back and check. If you can now remove that from the screen, thank you. And we also remind the people who are here on Zoom that you can put comments and questions on the in the question and answer section, but we also have quite a large number of people who are watching on Facebook and other manner. But I'd like to now take us to somebody who's on the ground dealing with these issues, and that's Dominic Konji. He's a senior public health and communication for development expert. He's a founding member and he's a president of the Cameroon Public Health Association, and he's a member of the executive committee of the African Federation of Public Health Associations in charge of policy and programs. He's a graduate of the University Centre for Health Sciences of the University of Yaoundé, Cameroon, and holds postgraduate diploma in public health and regional intercountry from the Higher School of Public Health in Central Africa in Brazzaville in the Congo Republic. Associations have always been very, very well received. Dominic, over to you.
Thank you very much, Michael. And let me say that I'm very glad to be part of this webinar. Well, as far as Cameroon is concerned, there is an expanded program for immunization in Cameroon since 1976. This program targets mainly children under 5, adolescent and pregnant women. Well, health professionals are not yet target population for routine immunization, even though they are occasionally vaccinated when an outbreak emerges. It's the case of COVID-19, for example. Well, the decision to consider health professionals a target population for routine immunization is, in fact, political. What it means that we need a decision at high level in the country to consider health professionals a target population of routine immunization. So this is why we think advocacy and policy advocacy is crucial. Crucial because this immunization program is in fact supported by development partners such as WHO, UNICEF, and mainly Gavi. So when we have to take a decision like this, I think we need to advocate so that at government level, this decision should be taken. But we are very interested in knowing that in terms of advocacy, WHO is already involved in this work with us. And I think this is it's very good. And many other development partners and global partners should be part of this, advocacy. So we insist on this policy advocacy that should target governmental authorities and their development partners. And also, we have to think of health professionals' councils themselves, because if we are reflecting on immunizing, let's say, protecting health workforce, health professionals must be first at the forefront to need and to request for protection. So I think something must be done with these professional councils in countries to draw their attention of the need to advocate for it, and then also to have engagement, decision-making, and resource mobilization. We think this is very crucial. Health professional protection is a right, I think, and protecting them against various infection disease is also protecting the whole society. So our reflection is about taking advantage of what the international public health community is doing now with this WHO recommendation on health professionals immunization. We think while this international health community is currently engaging in integrating COVID-19 vaccination into immunization programs and primary health care for 2022 and beyond, that will be targeting high-risk group, and these high-risk group are first health workers, older people with comorbidities, and pregnant women. I think this is an opportunity we have to seize to make sure this vaccination should not be also only for COVID-19, but it should be for many other antigens in favor of health professionals. Why not now seizing this opportunity to advocate through a design policy for a multi-antigen systematic protection of these professionals as part of occupational health, equity, and safety. And I say again that I'm very glad to know that you have already some global partners with us. Thank you very much.
Thank you so much, Dominic Konji, and I'm really pleased that first raised by Marta, then by Stephanie, the issue of advocacy, and Dominic, of course, saying, of course, advocacy is political, which it is, but don't forget our advocacy is also about how we reach out to other groups, medical professionals, universities, others, and of course, bureaucracies. So we need to keep building to ensure that we grow this challenge and that we work hard to protect our healthcare workers, particularly in low and middle income countries. I'd like to now move across the world to Mongolia and go to Dr. Mangagul Arizana, and who is a project leader for Hepatitis-Free Mongolia, which is a project funded by the Rotary Foundation since 2016. She's a consultant and auditor of the quality management systems and accreditation of healthcare organizations. She's also a member of the Global NASH Council. Mangagul, over to you, please.
Okay, good afternoon, everyone. So thank you very much, Michael, for the opportunity to share our experience in vaccination in Mongolia, specifically the vaccination for viral hepatitis B among healthcare workers. So, all right. So as you are aware, so Mongolia is very high in viral hepatitis B and C in the world. So as you see from this slide, so Mongolia is listed in #1 in liver cancer mortality in the world. So which is caused by viral hepatitis B and C. So almost more than 80% of the liver cancer patients diagnosed at late stage in Mongolia. So that's why we are very high. However, Mongolia is implementing lots of actions, programs to fight with the liver disease. So we implemented the Healthy Liver Program since 2017. So it was very successful program. So the government decided to continue this program to offer screening for all the population for viral hepatitis and liver cancer. So the hepatitis prevalence among healthcare workers are not very different from the HPV prevalence among the general population. However, the hepatitis B prevalence is decreasing due to the immunization introduced in Mongolia since 1992. So since then, among the people who were born after 1992, the hepatitis B prevalence is very low compared to the people who were born before 1992. That's why I would like to focus on the HPV vaccination for healthcare workers. And the Mongolia is working towards advancing the occupational safety for healthcare workers. So the vaccination, hepatitis B vaccination was initiated in 2004 and 2005. So the Mongolia is working towards to make the legal environment supporting the vaccination among healthcare workers. So there is a health ministerial order which is taking consideration the WHO recommendation to vaccinate healthcare workers. So especially those who are in high risk in healthcare care and service. So however, the WHO does not recommend to test the post-vaccination antibody titer in the blood. So the health ministerial order require all the healthcare workers to be tested after vaccination. So also recently the Ministry of Health updated the hepatitis guideline for the doctors, and this new guideline indicates after vaccination that anti-HBs titer must be over 100 among the healthcare workers. So it has to be tested again after 5 years. And so the booster dose needed for those whose titer is below 100 mil IU. And also, according to this health ministerial order, the medical students are included in the vaccination program. And however, so of course we have many challenges facing, and so the healthcare workers, the vaccination are responsibility of the employers. So healthcare workers does not pay the vaccination. However, the retesting sometimes is required to be paid by the staff and students. So we didn't have as everywhere else is same. So we don't have very good and reliable data on the vaccination rate of the healthcare workers. So in 2005, when we initiated that vaccination for hepatitis B, so the healthcare workers are required to be vaccinated 2 doses of HPV vaccine, but now they are required to get vaccinated 3 doses according to the WHO recommendation. And as I mentioned, we have some challenges, and also we need to improve the vaccination coverage among the healthcare workers. So we need to enforce the guidelines developed by the WHO and the government of Mongolia on the vaccination and testing. Also, we are lacking very good, reliable research and survey on vaccine efficacy among the healthcare workers. And however, there were a few funders, international organizations like Asian Development Bank, so supported some research initiatives to test vaccine efficacy among the healthcare workers, but the result was not finalized and not published yet, so I could not share the result with you. And we need also to have official record or reliable data on the vaccination coverage on the healthcare workers. So that's my presentation. So I will be happy to answer any questions. And so I would like to thank to sharing our country experience with you. So I am looking forward to learn from you during this webinar also. Thank you.
Thanks so much, Mungjagal. That's brilliant getting that insight specifically around hepatitis B vaccine. And no doubt, as showed on your slide, there are also, of course, emerging diseases. There's influenza, there's diphtheria, and we'll discuss those as well. So if you can stop sharing your screen now, and
Okay,
I'll go to Anila Walpa and Makinda, Dr. Makinda from Nigeria, and she'll be able to share her screen. She's a graduate of the College of Medicine at the University of Ibadan in Nigeria, and currently leads a team of medical officers in a reputable secondary level hospital in Ibadan City in Oyo Strait in Nigeria. She's an avid advocate for preventive medicine, and Dr. Makinda also works closely with other healthcare workers who are involved in vaccine-related training. It is fantastic, and Luopa, to have you here with us, and I hand over to you now.
Thank you very much, Michael. I'm grateful that we're discussing this topic today, because the health of healthcare workers is very important. Particularly in Nigeria, we're currently experiencing an epidemic of brain drain of healthcare providers. And this is...
Anawolupo, I'm losing you. Your screen's frozen for us at the moment. I'm just going to give you a chance to come back and see how you're going. While we are waiting for you, I note that there is a couple of comments. One is about sharing the links, and I've responded to that, saying that we'll be able to do that as we can. And one of our attendees from Zambia has also published healthcare workers. It's okay, Analupo. Let's see how we go.
Yeah. Can I speak?
You are now ready to go, please.
Yes. Thank you very much. Sorry for that. Yes. So I was saying that in Nigeria, we're currently having an epidemic of brain drain of healthcare providers. And so healthcare providers are seen like a scarce and a very important commodity. They're an essential group within our population. And particularly, this topic is targeting low and middle income countries like Nigeria, where there is scarcity of resources, PPEs, so that makes healthcare workers very vulnerable and exposed to vaccine preventable and modifiable diseases. And worthy of note, like Ayozana has mentioned, hepatitis B, northern Nigeria is known as meningitis belt. So currently Nigeria has a diphtheria outbreak, okay? So this topic is something that, yes, it's important to mention in Nigeria. Something that Marta mentioned during her presentation was the role of research. We ultimately are going to advocate, for policies that will ensure vaccination and protection of healthcare workers in our nations. But where there's paucity of data, paucity of information to back our claims, then our advocacy is going to be limited. And like many of the other speakers have mentioned, also in Nigeria, we have limited research materials, limited research information. And so I think that is somewhere to start in ensuring that healthcare workers are protected. I think part of our advocacy must include advocacy for research. Advocacy for research. This would also help us, seek funding, because funding is essential. In Nigeria, Gavi has done a lot of work in providing funds for vaccination, particularly childhood vaccination. But then there's the issue of donor fatigue. And then we also need to look beyond Gavi. We need to look at other, other NGOs, and particularly our government. So we need to be able to advocate for funding, because like I've mentioned earlier, healthcare workers are essential, scarce in Nigeria, an important population, okay? So high risk. We also need to engage our medical elders. I think Dominic mentioned something like that in his presentation, in that apart from getting advocacy from the government, healthcare different bodies of healthcare workers, different associations, and in Nigeria, particularly our medical elders who have, had more time in the field, has seen the risk, should have a louder voice in advocating for vaccination and other means of protecting healthcare workers, because truly, I think our risk it cannot be overemphasized. In Nigeria, there's no specific policy targeted to protect healthcare workers, but I don't think that's peculiar to us. I think many countries do not have a specific policy, but we need to come up with one. It would help, specific policies, for example, mandatory vaccination that's integrated within our pre-employment medical screening, and just to come up with an appropriate national policy that is specific to ensure that healthcare workers are provided. Educating our leaders, our community leaders, and then integrating this concept within our medical curriculum, so the medical students also come up with, are groomed also with this idea that they must not just doctors, nurses, all the health sectors where we have high risk of coming down with vaccine preventable infections. We should integrate this topic, the importance of protecting healthcare workers in their curriculum, so as to achieve our goal. Okay, so I think I'll stop here for now, and then we'll discuss more during the question and answer section. Thank you.
Thanks so much, Analupo, and you really touched on a whole series of very, very important things. I'd like to open the discussion, though. First of all, I'd like once again to acknowledge the support we've had from University of Geneva, from Pfizer, from the Italian Public Health Association, which gives me an opportunity to remind you that in early May, we have the World Congress on Public Health, which is in Rome. And of course, that's on the World Federation of Public Health Association's website. And we would love to have as many people join us as possible. Marta, I noticed you had a comment from somebody from Tunisia about the broad platform, and you had a response there. Would you like to just elaborate on your response that you put in the chat?
Sure, this one of the comment of the president of the Tunisian Public Health Association that is following the meeting from Facebook, as many other professionals. And he said that it is very important now to start with this specifically target action. And what they are doing in Tunisia is that they are in the process of launching a call for project for a digital platform for preventive vaccination for health professionals. So they want to listen from people working in the field, what are their needs, the main barrier they face, so to select the most effective projects. And I imagine, but this is to be discussed with him, then to bring at the government level and to see how to fund and support. And this is very much in line with what we have heard from the other speaker from Africa and Mongolia about this need to work together from a bottom-up and top-down approach to get the best outcome to protect the healthcare workforce.
Now, almost everybody has talked about advocacy, and I think it's incredibly important. One of the fundamentals that we're talking about is funding, but not just funding, but equitable access as well, that goes with that funding. Stephanie, you mentioned a series of policies that WHO has. So it seems to me that if you're doing advocacy work around funding and equitable access, that using those policies, plus what the World Federation of Public Health Association is preparing, is a way of reaching out to government, both bureaucracy and also at the political level. Did you have any further comment on that before? I know Dominique is very keen about this, and I'm going to come back to him, but can I start with you, Stephanie?
Sure, and you know, I think we're all kind of on the same page here. The important thing is sort of getting that voice, that united voice, up to the the ears that matter. And I know Gavi has been mentioned a lot, and other global donors, which is obviously an important piece of the puzzle. We, as part of the Gavi Alliance, are advocating strongly for inclusion of a healthcare worker vaccination package to be supported in future Gavi portfolios. So that's an ongoing piece of work. And if we are successful in securing that kind of seed funding, that will certainly be a facilitator to having some of these things introduced. But of course, it's not the full solution. There needs to be the government commitment that goes along with it. Even Gavi-supported vaccines come with a co-finance piece of the puzzle, and the whole idea is for sustainable vaccine introduction. So there does need to be that commitment from the part of the national governments to take this forward and ensure that this can be introduced in a long-term sustainable way. And so the commitment really needs to be there at the national level. And I think that the importance of including the health workers themselves, as our Nigerian colleague just mentioned, especially the sort of the seasoned, respected voices in the community, is a huge one, because it's self-advocacy. This is for their own protection, and it's potentially very effective to get health worker unions where they exist and medical associations to put forth a rallying cry to the governments to say this is a right, we deserve to be protected in our workplace, and this is a piece of that. So absolutely, there's lots of different ways that we can tackle this problem from all angles, and we're here to support however we can, and appreciate the efforts from the bottom up as well.
Terrific, thanks, Stephanie. Dominique, did you want to further comment on that?
My comments is that first we have to agree on the fact that protecting health workforce is very important. I think it's not, we don't have to take it for granted. You know, our countries, particularly in Francophone Africa, we are hospital centered. Let's say curative care center. So you'll find that in many countries, there is something done for to take care of health professionals when they are sick. You know, they go to hospital, they can have curative care. But we are not health promotion and disease prevention oriented. This is important. And this is why I think advocacy, you have to advocate to make sure at country level, even health professionals themselves understand that they need health promotion, they need disease prevention. And since it's a right for them, they have to advocate for it. Then the government. Now, when a decision is taken by the government, I think the question of funds will not be a big problem, because when the government considers that this is important, these health professionals have to be vaccinated. Now, it takes it in a regulation, in a policy, then the government will look for funds and advocating towards their partners like Gavi, WHO, and other partners. This is what I think. Funds important, but first awareness, advocacy, decision to be taken at national level, then the global level is there also to do something.
Thanks, Dominic. But as you know, public health is and prevention is always a big challenge to get money out of government, because the more successful we are, the less you can see for it, because then people aren't sick. It's a much clearer, of course, with vaccination. So, but I take your point, and I think it's a really, really important one. But it's something that we also have to watch. And Monjagal, do you have the same issues there in Mongolia?
Of course, we have same problem. So, however, so the government is working to advance occupational health and safety for healthcare workers through vaccination. So, however, there is health ministerial order available to vaccinate healthcare workers, specifically focusing on the high-risk professionals. So people, the healthcare workers, do not care about it. This is the main issue. They know their knowledge is very high. However, their practice is very low. Even though they are not reporting the incidents, needle stick incidents, or the biological fluid exposure, they are not reported fully. So also there is the funding issue. So all the medical students, they are responsible for vaccinating and for getting vaccination and for getting tested under their responsibility. So we need to work. We need to do more work to make this change it in Mongolia. So I think as our presenters shared their experience, so we have similar problems. So it's very important the World Public Health Federation initiated this action and uniting our voice and knowledge towards protecting healthcare workers through vaccination.
Thank you very much.
Also, we need to seek for the funders, to fund these protected healthcare workers. So in Mongolia, so as Michael and myself are Rotarians, so in Mongolia, we initiated the Hepatitis Free Mongolia funded by Rotary Foundation. So we initiated the vaccination for healthcare workers through this project. So once we offer free vaccination, free testing, so people are likely to join this initiative. So it's funding is also very important.
Indeed, and funding is the very first thing that we raise, of course. But as Stephanie pointed out, Gavi also seeks partnership because you want commitment from funding, and certainly Mangjagal, you and I know from our experience with Rotary International and polio in particular, that you can get huge amounts of funding and support where it's appropriate, but it does take a long time, and that also takes a lot of advocacy. Anna Lawopal, you've listened to the others. Is there anything you wanted to add in that respect before I go to talk about beliefs, literacy, and awareness?
I think the situation in Nigeria is similar to what the other presenters have mentioned. I would like to emphasize what the last speaker said about maybe healthcare workers also personally not being responsible enough for their health. There's underreporting of exposure incidences. There is some level of laxity in they themselves personally getting the vaccines, but I can understand that, especially for medical students, medical education is already expensive. Then they also have to pay additionally for hepatitis B vaccines, go check their antibodies titer assays, and they have to pay for all these tests. And so I can understand why one may just, be hopeful, especially in a country like ours that is very religious. No one will just be hopeful and optimistic and, oh, I hope I don't get it. But the exposure is not it's incomparable to the risk is incomparable to the care that we're providing. It's I think it's something that we should work on.
Yeah, and of course it's not just about personal, it's also about the protection of healthcare workers. When healthcare workers are protected, the community and their patients, and therefore the community, are also protected, and that's come through in lots of the discussions. I'd like to just refer to some of the questions that we've had. The first one from Felicidade is about any specific funding agencies who focus on hepatitis B research in healthcare workers in low and middle income countries. And Felicidade is from Mozambique. So I'll ask you to look at that question, but there's also a series of questions from Dr. Ahmed Mohammed from Ethiopia, who is asking us about future plans and how do you get future plans into government, and can you make sure that those future plans engage with the EPI strategies, and then also how do you support research? So those combination of things. So I'm going to throw that open to each of you, and this time I might start with you, Anna Lawopal.
Yes, okay. So I think I would start with talking about supporting research, because I think research is a very important place to start in advocating for protection of healthcare workers. Okay, so there are different levels of research. I think that we could start with the basic epidemiological studies, prevalence studies. We could start from there. I think healthcare workers need to be sensitized and inspired to find out the effect of basically starting from answering the questions, where are we right now in terms of vaccination of healthcare workers, so that we'll be able to know what more we need to do and then push for it. So people need to take up, the responsibilities and initiatives. And then even before we go to other levels of research that would need funding, and that's where we would also, need collaboration with international partnerships, local NGOs. And so I think it's a very good question, and that it's something we need to work on. Healthcare workers, perhaps themselves, in taking up the initiative to ask questions and then give us answers via research. And then based on that, we can advocate for funding for other levels of studies from NGOs and then the government.
Yeah, the sound research And good data is such a strong basis for advocacy, isn't it? And I think that's a really important thing. Stephanie, would you like to elaborate? I'll go to you, then I'm going to go to Marta to see if there's comments on these broad range of questions.
Yeah, thanks. I actually wanted to respond to the question about a parallel, working in parallel with in strengthening the regular EPI routine immunization program. And that's really important because many of the vaccines that we recommend for protection of health workers are in fact childhood vaccines that ideally, if these health workers are getting 2 doses of measles and rubella, 3 doses of hepatitis B as part of the routine vaccinations that they receive in childhood, then they're protected. And by the time, especially for future generations of health workers, by the time they reach entry into the health workforce, they won't actually need to be revaccinated. That's where the importance of implementing a screening process of vaccination checks and maintaining good records so that by the time the health workers reach, or these young adults reach their medical training, they have a record that shows that they've received these vaccines, and then it's just a matter of sort of ticking that box. Yes, they're protected, and on you go. And so it's really a whole systems investment that will really pay off in the future. It won't be necessary to be revaccinating health workers in adulthood if they have a strong foundation during childhood. So absolutely, this should be part of the investment for the immunization program overall, and moving towards the idea of a life course approach to vaccination. So starting from childhood and then providing those opportunities for catch up throughout older ages. So
I'm really pleased to hear you talk about the life course approach as well, because that's something that the World Federation of Public Health Associations, and particularly our Global Task Force on Immunisation, has been working on. Marta, did you want to elaborate on any of those areas before I go to Dominic Konji?
Sure. On top of what had been just said by Stephanie about the system approach, I guess we need to think about the fact that for COVID, we have built in low and lower middle income countries infrastructure to vaccinate also the adults. And this happened in countries where we don't have routine immunization for adults. Of course, it worked in different ways and more or less efficient ways, but there have been efforts towards this direction. And this is something we should not miss. So when Dr. Mohamed asked about the next step implementation and so on, I guess we need to take advantage of the fact that somehow in different ways, infrastructure have been put in place to vaccinate adults for COVID. So we need to take advantage of those same infrastructure to guarantee the needed vaccination for healthcare workers. And when I speak about infrastructure, I mean not only the building, but also production, delivery, access, communication, capacity building, and everything that is very different and sometimes very complex according to the country, but has been done and should not be lost, but used for expanding the vaccination to other needed vaccine for the healthcare workers.
And as one of our colleagues pointed out in the process of developing our policy, that we should also be looking at where appropriate, that countries are also being able to produce their own vaccines and encouraging that investment as well. Dominic, do you have any further comments on any of those issues we've raised so far?
Well, I'll just add something on research, and there is this epidemiological research, but I insist on behavioral research. We will need to conduct behavioral research with health professionals to understand what are their needs, what is their understanding of this health protection. And I think with behavioral research and epidemiological research, we will have data, local data that will help us develop local plans. And these plans will help advocate at local level. So just to emphasize on behavioral research.
What an interesting aspect, which we hadn't touched on before. And I think it's you've raised a really important point that we need to note. In Mongolia, Mongjagul, are you facing all the same sorts of issues?
So the vaccination for healthcare workers is mainly through the national health insurance. The funding goes through the health insurance, but the some vaccination with epidemiological indication provided by the government fund. So according to the government legislation, so the health care organizations should arrange the funding for the healthcare workers vaccination. So the research, so we need to have very good research base in order to, as you mentioned previously, to have good advocacy, and the efficacy of the vaccination is very important. We need, as I mentioned in my presentation, so it needs to be tested on regular basis and communicate with the healthcare workers. So, sorry.
I was going to ask, what about the records, the national immunization registers and things like that? Because it's one thing to be immunizing, but as Stephanie mentioned, some of the healthcare workers will have had their measles vaccination as children and MMR and so on. What about I know in my own country that COVID really accelerated the recognition of the need for an appropriate register, and how much has that been extended, and I wonder how much that's had an impact in low and middle income countries, and particularly yours in Mongolia.
So in Mongolia, there is under Ministry of Health, there is a National Center for Communicable Disease. There is the vaccination division,
yes,
operational, but their main function is to collect information for the universal vaccination.
Yes.
So they are not collecting data on the healthcare workers vaccination. So that's why we are lacking very good data on this. So we need to focus on who is going to be in charge for the healthcare workers vaccination. So maybe health development
cross those two registers.
So because this there is nobody, no legal entity to be in charge for collecting information about the healthcare workers vaccination in Mongolia. So maybe this needs to be improved in the future. So maybe we should concern on this.
I don't think Mongolia is on its own on this, and even in developed countries, this is a very, very recent thing where we've got sensible registers. Do you know about Nigeria at all, Dr. Makinda, and the registers and how information is kept?
It's similar to what Ayurzana has said.
Jaga.
Jaga.
Okay,
Jaga.
Jaga. Yes, thank
Jaga
you.
is easier.
Yes, thank you. It's similar to what Jaga has said. We also have the NCDC, National Center for Disease Control, with the vaccination arm, and also what record keeping. It's in recent emphasis, but the focus really is childhood vaccination, universal coverage, and there's no specific record for healthcare workers vaccination. And so if like she's recommended.
We've just lost you for a moment, Anna Luwapo. And so I'm going to go to Stephanie and see what sort of information that if she has it, the World Health Organization has in terms of the changes that are happening there. When we get a chance, we'll go back to Anna Luwapo.
Yes, indeed. There's a lot of work going on in this area. I mean, of course, this work was going on even prior to the pandemic, but as you mentioned, Michael, the digitization abilities that many countries have been able to accomplish for COVID-19 vaccination has really accelerated this movement and the recognition of not only the importance, but also the feasibility. And so there's a lot of momentum now because of that, that's trying to be leveraged. Both for electronic health registries and personal health records as well. The personal health records, of course, that we refer to for immunization, the home-based record, even something as simple as a physical card that parents can have for their children or individuals can have for themselves is still lacking in a lot of countries. And so the idea of moving to an electronic registry, of course, it's a very attractive solution to this this ongoing problem of losing these records, but it also, there needs to be a bit of a reality check as well that in some contexts, and this isn't really just a low income versus a high income situation. This is everywhere. I think you'd be pressed to find a lot of adults, even in high income countries, that can still locate their childhood immunization records. We're not doing a good enough job at recognizing the importance of maintaining these records for ourselves as we move into this idea of a life course vaccination approach. The importance of having a personal health record that carries through with you is even more fundamental. And so we're also doing a lot of work to advocate for the importance of having these records available to mothers and individuals for retaining these records for their children and themselves, and then that will help to contribute to the continuity of care for a person on their own. In parallel to that, of course, the work going on to build electronic systems is there, and it's not an easy thing to do. Australia is pretty much the gold standard that we have globally because of the idea of this national identification number that follows the individual that doesn't really exist in a lot of countries. Australia has done a really good job at that, and so it's really it's an example that is widely recognized as something that we would like to see more countries achieve, but it's a really difficult path to get there. So,
and we only actually got there using COVID as a springboard for those of us who are doing the advocacy work around that. I do note that Moisa points out that in one study, they tried to give the healthcare workers cards, and then most of the healthcare workers lost their cards. So, of course, like every study, there's always issues and about how we go. Anabalupo, can we come back to you to complete what you were saying, if that's okay?
Yeah, so I was just trying to say that there's no specific record for healthcare workers specifically, but there is record data generalized for vaccination history. Okay, so we can assess that.
And that becomes really important to be able to cross-reference that in the future, and I think that will become a really important part of being able to check with healthcare workers. I'd like to go to the issue of the beliefs, literacy and awareness, because we know in the broad communities that sometimes religious beliefs and faith that I won't need it because I'll be protected it has played a really important role, but also the importance of faith leaders in and getting them on side. I do know that with regard to polio, this has been a very, very important factor in bringing countries and individuals at all sorts of levels on side. How do that issue of beliefs, literacy, and awareness operate in Cameroon, Dominique?
In Cameroon, I think it's the same thing in other countries. We generally think that we are health professional. We have to educate the population on health matters and sometimes on immunization. But we forgot the fact that even though we've been trained in health as health professionals, each of us has his own beliefs. cultural beliefs. And we have to know that sometimes we advise people to vaccinate their children when some of us are not ready to vaccinate their own children. And it's the same thing for themselves, ourselves, health professionals. We advise people to vaccinate, to be vaccinated, but we don't work on it. We don't make sure we are vaccinated. And this is why we are saying that there is something to do in terms of literacy. Apart from training as health professional, these health professionals also have to undergo an education sessions for their beliefs. And this is why we're talking about research. Conducting a research with health professional, behavioral research, you will discover that even though they have knowledge on health, they have knowledge on immunization, they don't sometimes believe on immunization or immunization for some antigens. So my concern is to say we need to emphasize on health literacy concerning health professionals to increase awareness, to work on their beliefs, and then to look after vaccine hesitancy. Because vaccine hesitancy among the population is aggravated by vaccine hesitancy in health professionals, in health workers. This is what I think.
Yeah, I think that's a really good insight, because how much more influence does a health worker with vaccine hesitancy have on people who don't have the training and don't have all the information? What's the situation in Mongolia there, Jaga, in terms of the belief leaders and religious and cultural approach?
So very interesting question. So so there is no big difference in religious situation or the national like minorities.
Yeah.
So the Mongolia is quite high in literacy rate in the world. So everyone, so we did a few years ago, we did knowledge attitude practice survey among healthcare workers. Oh my God, I'm so sorry, the child was crying. And the knowledge was very high among the general population. However, the practice was very low. And also, it's very important to improve the attitude of healthcare workers towards vaccination. Because some of them think this is because by the employers' initiative, but it's to protect them, not healthcare workers. Yeah, so it will protect their and also the financing budget is very important. So, okay, I have to stop in that.
You know, please, priority one is looking after your family.
Yeah, I need to calm down my little one, so I'm very sorry.
No, thank you. Thank you so much for your contribution. Ana Lupo, can we go to you, please? Doesn't that make our webinar much more human? I think it's great. And I think you may have frozen again, Ana Lupo. Stephanie, while we're coming back there, can we just go back? First of all, I note the comment in the chat box for Dominic, the support that Dominic had, and I think that's absolutely right, that people are aware that even nursing students are saying they've heard something instead of relying on the evidence.
Yeah, so I mean, I think we see this everywhere. It's usually not unique to one community or one national context. There's been a lot of good research, particularly around the influenza vaccine, because that's one that's been targeting health workers specifically for a long time now. And then, of course, in the last couple of years with COVID as well, there's been a proliferation of research done on this particular in this particular area, looking at ways to increase uptake of these vaccines among health workers, and what are the sort of common hesitancy or sort of trust issues that have been coming up. So at least we do have a pretty good robust research base around that, and some recommended solutions, but I can't underestimate the importance of really getting the specific context of your own population. So to Dominique's point, conducting that kind of behavioral research within your own program to identify really what the specific issues are that are coming up, the specific concerns, listening to those concerns, and then addressing them in a tailored way is obviously the best approach. So it's kind of good that we have some sort of general, widely recognized common concerns, and then the importance of recognizing the specific ones to tailor your interventions. But it's also just important to recognize that health workers are just people at the end of the day. And so, we expect that because the medical training is there, that they're immune to some of these other sort of common misconceptions. And there's so much misinformation out there in the world today that is just everywhere you look. And so, of course, health workers are getting hit with that as well. So they're an educated population, but they're also just human like the rest of us. And so you have to recognize that and think about what are the best ways to ensure that the right information is getting through, and then hopefully they can help pass that along to their patients and communities as well.
Remembering that healthcare workers are not all specialists on vaccination.
Absolutely.
And
Yes.
and they have specialists. An orthopedic surgeon is not a specialist on vaccination, but it'll be a doctor, and people will ask. So that's really important. Mangjagal, I'm very pleased you come back with your son/daughter, with your child, and how cute. Excellent. And
She came from the kindergarten.
and she sees her mum on television doing a webinar, and how great is that? And did you have anything else you wanted to add, if you can concentrate enough?
Okay.
Because we are coming close.
There is another issue I would like to add. So we need to identify, recognize who is going to fund the medical students vaccination. So
yes.
So maybe it can be included in their tuition, or maybe government should have a different funding to vaccinate healthcare workers, including medical students. So another thing, as I mentioned previously, the data, the national immunization data is only the children's immunization data. So who is in charge for collecting the immunization data nationwide for healthcare workers? Maybe if WHO requests the Ministry of Health to submit the healthcare workers vaccination data, so Ministry of Health may start collecting that data somehow. So these two issues I would like to add. So thank you very much for everyone.
Thank you very much. And I'll go to each of the other speakers now, but this is the opportunity to add anything that you would like to add, apart from answering my question about beliefs, literacy, awareness, if you haven't already done so. Anawalupo, can I go to you? Yeah. So is there anything else you wanted to add with regard specifically to the beliefs, literacy, awareness, or any other issue that you thought was important to raise, or to elaborate on what one of the others has raised?
Well, yes, I was trying to say that in certain political zones in Nigeria, the uptake of immunization is very low, less than 10%, less than 5% in certain localities. And because, like Stephanie was talking about, the life course, once we can immunize our children, then we know that we've immunized the future of healthcare service providers. So I think education there, outreach is there to ensure the right information, because many times the reason still boils down to misconceptions, misperceptions.
We just get Ana Lupo saying the most important things, and I think we've got the message when she's frozen, so it must be very frustrating for her, but I think we have got a very clear message. Dominique, I'm going to go to you, and I will come back to Ana Lupo if she comes good. But Dominique, did you have any final comment, or and I would like you. We've listened very carefully about behavioral research, and I think that was really important.
I think the issue I can raise after talking about research, advocacy, literacy, partnership is ownership at country level ownership. I think we can discuss on all these issues at global level, but it's at country level, people are not, don't take it into consideration. I think it will take time to work. So I insist on country ownership, action at country level, and ownership of country level.
Yeah, yeah, that ownership is really, really important, and I think that also, in certain extent, a little bit of competition between countries is not a bad thing either. Marta, I'll go to you. Is there anything else you would like to raise?
Thanks, Michael. Maybe one point that was somehow highlighted also by Monjago is that we need to make a decision and a clear definition of the person that is in charge of a part of the immunization process. We said we need to work with several organizations at different levels, but I guess it's very important to define a person in charge that is responsible and that should be accountable for the work that is requested. Because sometimes in such complex processes, we lose a lot of, let's say, resources at a different level. And this impacts a lot the outcomes, so the provision of the vaccination. And if we can make the process more straightforward and more accountable, defining specific person in charge, this may help a lot in getting better outcomes.
And I do note a comment from Aditya Makarenge that funds for implementation of healthcare worker vaccination programs should include M&E and data management, so that, and I, of course, research. And I think it's a really important thing. Let's have one more try, Ana Lupo, and see if you can get that last comment in.
Mm-hmm.
I think we've still got you, Ana Lupo.
Yes. I was just trying to emphasize that we still need to educate our community leaders, political leaders, religious leaders to enhance uptake of the vaccination, because there's still a lot of deficits even in the national routine childhood immunization coverage. And I was alluding to the fact that this is important because Stephanie has made it clear in the life course of immunization, where if we can catch everyone young, then we can be sure we've immunized the future of healthcare service delivery.
Thanks,
Thank
Ana
you.
Lupo. I'm really pleased we finally got you there. Stephanie, have you got any short final statement before I conclude?
No, I don't actually. I think we've said everything. It's been such a great experience to hear from the other panelists, and I'm encouraged to hear that sort of we're all speaking with the same voice. And thank you to you guys, the WFPHA, for doing this work and sort of encouraging the voices at the national level to drive this agenda, because that's really where the important voices are. This has to be a bottom up call, and so yeah, this has been really great to hear from everybody today. Thank you for including me.
Pleasure. And I'd like to really conclude with a little reflection from Australia, where the HPV vaccine, human papillomavirus vaccine, has been so successful that we're now talking about the end of cervical cancer. And it's an extraordinary thing. But there was a time when some religious leaders started to say, well, this is going to encourage promiscuity. And of course, the advantage was, with good discussion with those religious leaders, we're able to turn that around. So the advocacy was incredibly important in that area. So I want to thank the staff there at the World Federation of Public Health Association, Marta and Maria in particular, and Razia, but also the University of Geneva and Pfizer and the Italian Public Health Association for their support. I want to remind people about the World Congress on Public Health, and I'm going to ask Marta just to remind people about World Public Health Week very, very briefly before I do my final closure.
Sure. So we have two main initiatives that will start very soon. One is the World Congress on Public Health, 2 to 6 May 2023 in Rome, Italy, as Michael said before. And the other one is the Global Public Health Week. That is an initiative we started last year to drive the world attention on the importance of public health. Is 1 week from 3 to 7 April, is always around the World Health Day, where we invite all organizations and professionals worldwide to do something around public health, to build literacy, to keep the attention high on the importance to prevent disease and to manage them in the best possible way. Vaccination is one idea, but there are plenty of approaches that public health can apply and should apply to protect our communities. So I invite you all to consider doing something. You have a dedicated webpage on our website with all the information, but basically you do an event, competition, webinar, workshop, whatever you think is appropriate, you inform us and we give visibility. So to make sure to make a lot of noise around the importance of public health globally.
I'd like to thank our audience there on Zoom and also on a bigger audience on Facebook. And it's been a pleasure having you with us. I'd like to thank Stephanie, Dominique, Jaga, and Annalupa for your really significant contribution to this discussion. And I now declare this webinar closed.